Hi, my name is Brenda, and I am having Lipo 400 with a fat transfer to the butt, which is also known as a BBL, and I'm having a rib remodeling to help contour my waist. So I've always had somewhat of a boxy frame. I've had lipo in the past. Even though I was happy with my results, I was just never able to get that snatch, that small waist that I've always kind of wanted. So that's the main reason. So I chose Dr. Marshall's for the rib remodeling. It's because, like I said, he is highly skilled in this type of surgery. He continues to train, he continues to learn from the best of doctors in the world. You know, he continues to train with doctors like in Colombia, you know, who actually, you know, do a lot of these ribs out there. That's the reason I wanted to go to him here in the United States. I just feel like in the United States, there's just not a lot of doctors who are doing really good remodeling, honestly. I've seen a few, but just the way that Dr. Marshall does it, like his technique is just different, you know? It's like going to Colombia, but not going to Colombia. That's the best way I can explain it. So that's the reason I chose him. And like I said, he's very skilled in that type of surgery. And yeah. So what I'm trying to achieve, so I actually had silicone butt injection removal. So I have a lot of unevenness when it comes to like my butt. My previous doctor who did the removal, he did an amazing job. I absolutely love my results. I'm just not very happy with what it looks like. So it doesn't matter how many hours I spend at the gym working out, doing all these glute exercises, I'm just never gonna get that shape. And that's the reason I want to do this surgery, because of that. It's just, you know, I just feel very self-conscious about it. And, you know, I kind of want to build my self-esteem again and feel good. So that's one of the main reasons, is for reconstruction. Due to my removal, there's just certain things I can't wear. I can't wear certain things as far as bikini wise. I just don't feel confident. Like literally, this is like my comfy, this is like my blanket, I call it. But I just want to feel good. I want to feel like a woman again and be able, you know, to run around in a bikini and just feel good in clothes. And even if I run around naked, like I want to feel sexy. So that's, you know, I need to build my confidence. And I feel like if you have that confidence, I think it kind of goes with other things in life. It just, you know, but that's pretty much. I'm excited. I really want to get this done. I already know like it's going to look amazing, to be honest with you. So I'm not even nervous. I'm just like, I just can't wait. So yes, I'm really happy. Like I said, I'm in good hands.
And just taking these 3 ribs in, 12, 11, 10, that will make your waist smaller. But, you know, you're in Beverly Hills. This is Dre Sculpt. We're going to go a little bit more.
Exactly. Let's do the rib lux.
It's the rib lux it is. It's the Dre Sculpt rib lux. So we're going to do that on both sides and get you all snatched up. All right, so our lovely patient today is coming all the way from Texas for surgery. Now, she's had lipo twice before. It was quite some years ago. I think her first lipo was like maybe back in 2002. And back then, I don't think we had a lot of the advanced techniques and education we had around lipo that we do today. So you see a lot of contour irregularities. A lot of people will refer to that as fibrosis, but what it really is just uneven lipo. And 90% of the time, that's what fibrosis really is. It's just uneven contours from previous lipo. Oftentimes when you're too aggressive with the lipo, too close to the skin, you're gonna see a lot of these contour irregularities. It's not always easy to try to fix it, but sometimes we can lipo in such a way to blend in and make it a little bit less noticeable. And so using the Vaser today, that'll be the goal, is to lipo this entire area and make it slightly less noticeable. In the back, I will make a tiny incision right above the butt crease here, well hidden, to lipo all of this. And then we'll get all of this as well, including the buffalo hump. And then tiny incisions to get the arms. This will be Vaser lipo. I use the Vaser to help break up the scar tissue and the fat. She has a lot of scar tissue from previous surgery, so the Vaser will really help to get smoother contours and to avoid a lot of that lumpy, bumpy deformity, which is very common with more juvenile or inexperienced liposuction. And then to top it off, the icing on the cake. will be the rib remodeling. She has a very boxy frame overall, and so by addressing the ribs that are deep under the skin, ribs number 12, 11, 10, 9, possibly 8, that'll really help us to contour and bring that waist in, because even if I do the best lipo in the world, which she is going to get today, she's still going to have more of that boxy frame. And so the rib remodeling will really aim to really bring that waist in. I'm hoping to get, you know, when it's all said and done, upwards of 5 to 6 inches reduction on her waist, if not more. It all depends on how well she wears the corset. My signature rib lux procedure will also include the front ribs as well, so we'll address the front ribs. So a combination of back and the front will really help to narrow that waist and to shrink her frame. I was the first person in the United States to do both the front and the back ribs. So often imitated, rarely duplicated. This is a very complex case. Like I said, she's had this previous scar here just to go in and remove a lot of silicone that was previously injected. I don't inject silicone. Sometimes I'll remove it, but this is more almost like a reconstructive BBL because, you know, she's had skin removed, silicone removed. Now we're trying to add some volume safely in order to restore a lot of that pop. So lots of lipo. You can stay tuned for the final result because this is going to be a crazy case. I'm going to go eat like 3 street tacos and 2 burritos right now just to get amped up and geared up for it. All right, you ready to rock and roll?
Absolutely.
Let me get a high five.
Yay.
Yes, let's do
Do
this.
this.
Ready for timeout? Our patient today is a 43-year-old female. She has an allergy to white tape, which causes a rash, and penicillin that causes hives. Is that correct? She's 5'2", 155 pounds. Her HemoQ today is 13.6, pre-op hemoglobin 14.2. Supine under general anesthesia. The STDs are on and confirmed to be working. The body warmer hot dog is above and below it's on.
Correct.
All right. PXA MSTEF.
Was given 1 minute after arrival. No reaction was seen to the answer.
Okay. Any anesthesia concerns?
No anesthesia concerns.
All right, so we got another case today, Lipo 400 arms and the BBL. So this patient's had Lipo twice before. She's actually already fairly thin, so we're just gonna be working on smoothing some of her contour regularities. But even with her 2 previous lipos, you can see they left a lot of fat right here. So this area has never been touched. So that's why my lipo is Lipo 400. I do always contour this area just to the side of the breast here and the armpit fat here that often sticks out of your bra and your summer clothes. So you'll see a huge difference once I'm able to lipo that area right there. All right, so this is a difficult case today. It's a revision lipo. She's had lipo twice before, 2002 and 2017. Even though I've already put the tumescent in, you can already appreciate and see some of the contour regularities and scar tissue. So in order to address that, today I'll be using the Vaser. This Vaser will help me to break up a lot of this scar tissue and fat. The goal is not to remove a lot of fat from the abdomen, it's to try to give her some slightly smoother contours. And so by breaking up the fat, both superficial and deep, we're hoping to eliminate a lot of those contour irregularities. Okay, so I just finished the lateral chest area of this Lipo 400, and as you can see now we have a nice contour to the breast here. We've removed a lot of this fat that keeps a lot of women looking really wide and boxy. And just doing this area alone, you will see I was able to get over 300 cc's of fat. So if you look there, you can see the power of doing the lateral chest and the abdomen. So why are revision lipo cases difficult? I often equate it to like tattoos. Doing a cover-up tattoo is much more difficult than doing an original. So if I'm the first person to touch you, it's a lot easier and a lot more controlled when I do that procedure. When you've had multiple rounds of liposuction, you may not always see it or you may not feel it, but we as surgeons know that there's a lot of scar tissue underneath the skin, and that scar tissue makes it harder to get nice contours. When you've had previous aggressive liposuction, it makes it much more difficult to do a tummy tuck. So revision cases in general are always more complex. It leads to a little bit more bleeding, more bruising, a little bit more scarring, and sometimes more downtime. So it's more complex for us as surgeons and for you, the patient. So this patient's had a previous lipo and BBL, and she also had silicone injections done well in the past. She's actually had silicone removal. We'll show you that when we flip over. So she has a lot of scar tissue. She has some asymmetry for buttocks. And so our goal today is to try to improve upon that symmetry. She knows it's not going to be perfect, but if we can make it better in a safe way, that's the goal. So revision cases, always tougher. Doesn't mean it's impossible. We evaluate revisions case by case, but like I said before, the best treatment is prevention. All right, so we finished up the anterior or the front part of the Lipo 400. So as I mentioned, this is a revision case. So she had a lot of contour regularities, and so I've done some Vaser, I've done some other tricks in my toolbox to help break up a lot of that fibrosis and scar tissue. Added just a little bit of light definition, which will distract the eye from any other irregularities she has. So now that that's done, we'll move on to the riblux portion of the procedure. So what is riblux? So that's my technique for when I do rib remodeling. You'll hear a lot of people popping up and doing rib remodeling, and that's great. It's a safe procedure when done in the right hands. But my technique involves both a front approach to the ribs and a posterior approach. As you know, I was the first person in the United States to bring that to the United States from Peru, where I addressed the front ribs and the back ribs at the same time. The reason why I do that is because I can get a more slenderized waist and a midsection. So not only can we reduce your waist, but we can reduce your underbust as well, which also contributes to your overall waist circumference. So that's the riblux. So who's a good candidate for riblux or rib remodeling procedure? Most patients are a good candidate. What you don't want to have is a lot of visceral fat, because if you have a lot of internal fat, then those ribs are never going to really move in the way you want them to. So we ask that you have a reasonably healthy BMI. Also, if you have a lot of unrepaired diastasis from having multiple children, it's often best to get that fixed during or before you do rib remodeling. Otherwise, if you don't have any history of very strong acid reflux and you don't have any history of any bone diseases, most of the time you're going to be a good candidate for rib remodeling. It's a procedure that takes under an hour under general anesthesia, and you're usually going to see anywhere from about 3 to 5 upwards of 6-inch reduction in your waist, depending on how well you wear that corset. You know, every patient surprises me when it comes to how many inches they lose. It's like Christmas Day. I do find that patients who wear their corset more diligently and who wear them longer often get better results. So for the most part, I do nearly identical fractures of the ribs on most patients, but I do notice that there are patients who wear that corset a little bit tighter and a little bit longer than others, and that ultimately determines the final result. So what am I doing during the riblux procedure? Well, just imagine this Q-tip is your rib here, it's intact. All I'm doing is I'm going in with a tiny needle and I'm just causing a small break in the rib, okay? I don't remove the rib, I don't break it in half completely. When you wear that corset, that rib is going to continue to move in just like that until you form new bone, or what we call a callus, and once that forms, that will be the new shape of that rib. However, for those who don't wear the corset or who are always taking it off and on, that rib will go back to its normal position. So when I look at somebody who's had the procedure and hasn't gotten great results, it's typically because they weren't wearing that corset each day, tightening it and bringing that waist in more and more. In the right hands, riblux is very safe. I think it's very important to make sure that your surgeon has done training in this and is very aware of how to take care of any complications. Being here in LA, I hear a lot, I see a lot. It's not uncommon that I hear of somebody being admitted to the hospital for what's called a pneumothorax, or an injury to the lung. That's something that's never happened to me. Could it happen? Theoretically, yes, but I take a lot of precautions, such as using the ultrasound and taking training courses to make sure that I'm very, very safe during this procedure. And so safety number one. I don't care how good you look, it's more so about your safety. I want to make sure you wake up to go home to your family just like you came in. So when I first started, I just did the back ribs and the results were excellent. But you know, if you know anything about me, I'm always trying to, you know, shoot for the moon, because sometimes I'll land amongst the stars. And so I did a little research and found that even doing some work on the front ribs as well, in combination with the back, I sometimes will get an additional 2 to 3 inches added to the waist reduction. Rarely does anybody complain about having a smaller waist. Scraping, just clearing the periosteum off the rib. So this is the piezotome. It's a device that has a propensity to cut bone. When I do this, there's water coming out, and it doesn't cut me, but it will cut bone. So it's very safe for the skin. So I've completed the anterior portion of the Riblux rib remodeling procedure. I use ultrasound for the entire procedure, and that's number one for safety. There's a couple things I can always identify with ultrasound if you look here on the screen. So I can always see the rib, but then more importantly is I'm always watching the lung. So I've already done a total of 4 ribs each side here, and you can see the lung itself still sliding and moving. There's no air around the lung, there's no fluid collections, and so that means I've avoided any injury to the lung. So that's the important thing, is you got to know how to do this procedure, you have to know how to use ultrasound, and you have to know how to stay safe. So I've completed the anterior portion of the Riblux procedure, so I've addressed ribs number 7, 8, 9, and today I had to do 10 as well because 10 was attached anteriorly to the cartilaginous chest wall. So if you zoom in here, you can just see these tiny incisions. These are just made with a tiny little needle here. Those will heal great on their own. So we've brought the waist in already anteriorly, and then I'll flip the patient over and do the same on the back, and I'll address a whole different set of ribs. So I don't know if you can see on this side as well, I've addressed ribs number 7, 8, 9, and 10 through some tiny little needle incisions, which will heal and be imperceptible. So how many ribs is not so much as important as what is the end goal. So everybody has different anatomy, and some patients I do more ribs than others, but it all depends on your baseline anatomy. So it's not about the number, it's about the final result. So make sure you find a surgeon who can deliver safety and produce the results that you're looking for. All right, so got the ultrasound on our patient who's had previous silicone injections, previous BBL, and then silicone removal. So now we're doing another BBL. So here you can see the muscle is down here and the fat is here. This picture is not as clear as we want because she's got a lot of previous surgery. There's a lot of scar tissue in there as well. But here is fat, and the muscle is down here below. So as I'm doing the BBL, the goal will be to stay in this deep fat layer when I'm injecting today. But you can see though, she's got a lot of scar tissue, and that's why you don't really see very well defined planes. And so that's when the ultrasound becomes extremely critical for safety in these cases. There is no such thing as scarless surgery. If anybody uses the term scarless, they're technically lying or misleading you. As surgeons, there's no way we can do anything invasive without penetrating the skin. Once you penetrate the skin, you have now made a scar. Now, in some people, that scar is barely perceptible or it heals really well, but there is no such thing as scarless surgery. It's a scam, it's a gimmick. All right, so all finished up with the Riblux rib remodeling. So as we talked about before, I did the ribs in the front. I did ribs number 7, 8, 9, and 10 in the front. And in the back, we've done ribs number 12, 11, 10, 9, and 8. So I used a tiny little needle to get down to the ribs. And so you see these like tiny little holes here. Those will heal. It's not considered scarless because I did make an incision, but it's gonna heal very nicely, like a little tiny freckle. So Riblux rib remodeling, did quite a few ribs, really trying to bring that waist and snatch it in. If you can see from the top here, you can just kind of see that how this new curve is going to come in just like this. Once you wear that corset, I'm hoping for about a 5 to 6 inch waist reduction once it's all said and done. What our end goal is here with the ribs, just trying to get that waist really snatched in. All right, so we're all done. Big case. This was revision Lipo 400, revision Lipo of the arms, revision BBL. Very complex case when I coupled that with Riblux rib remodeling. So I did front ribs 7 through 10, back ribs 8 through 12, so multiple fractures. She'll have some discomfort, but I promise she'll get through it. Everything was done under ultrasound, BBL, the ribs, safety, safety, safety first. So got lots of fat out of her arms, over 800 cc's of fat from her arms, got over a couple liters of fat from her back, did a very moderate fat transfer. She had previous silicone that was removed surgically, and so we added fat just to bring back a little bit of volume, and obviously the signature Riblux rib remodeling. So you can kind of start to see kind of those curves already in the waist as we lift up. You can see how much smaller her waist is already. And now I'm going to show you from anesthesia's viewpoint, from the top of the bed, just how small we were able to get her waist with just the rib remodeling and the lipo. So just check out that new small waist, and it's going to get even smaller. Oh yeah.